In the quiet corridors of UCSF Medical Center, where miracles happen daily and hope fights against impossible odds, one story stands out among thousands. It's the story of a man named Dwayne Teach, whose journey from the brink of death to a second chance at life would challenge everything the medical team thought they knew about human resilience. Dwayne was 58 years old when his world collapsed in the span of 7 days. A simple man from Fortuna, California, he lived a quiet life, never imagining that he would become the center of one of the most extraordinary medical cases the hospital had ever seen. What started as flu-like symptoms on a Monday morning would spiral into a medical emergency so severe that even the most experienced doctors doubted his survival. But this isn't just Dwayne's story. It's also the story of Dr. Kim, known throughout the hospital as Dr. Miracle, for his lightning-fast hands and unwavering determination to save every life that crosses his path. With his team of dedicated medical professionals, Dr. Kim would face one of the most challenging cases of his career, a case that would test not only their medical expertise, but also their faith in the impossible. The central conflict began when Dwayne's body started shutting down, one organ system at a time. A massive pulmonary embolism had triggered a cascade of life-threatening complications that left him teetering between life and death. For 10 days, he would remain in a medically induced coma, connected to machines that breathed for him, pumped his blood, and kept his organs functioning while his medical team fought an uphill battle against time. What makes this story truly remarkable isn't just the medical complexity or the innovative treatments used to save Dwayne's life. It's the human connection, the bond between a patient fighting for his life, a daughter who refused to leave his bedside, and a medical team that saw beyond the failing organs to the man worth saving. It's about the moments when medicine meets humanity, when clinical expertise combines with compassion, and when the impossible becomes possible through sheer determination and hope. As we follow Dwayne's journey through these critical days, we'll witness the delicate dance between cutting-edge medical technology and the healing power of human connection. We'll see how Dr. Kim and his team navigate the complex world of heart failure, mechanical devices, and organ transplantation while never losing sight of the person at the center of it all. This is a story that will take you inside the intensive care unit, where every beep of a monitor could signal hope or despair, where split-second decisions mean the difference between life and death, and where miracles aren't just wished for, they're fought for, one heartbeat at a time. So join us as we unfold this incredible journey of survival, resilience, and the extraordinary power of modern medicine combined with unwavering human spirit. Because sometimes, the most powerful medicine isn't found in a bottle or administered through and for. Sometimes, it's found in the refusal to give up, even when all odds seem stacked against you. Subscribe and stay with us as we dive into this remarkable medical drama that proves that miracles do happen. They just require the right combination of skill, technology, and an unbreakable will to live. As Monday morning dawned in Fortuna, California, Dwayne Teach woke up feeling slightly under the weather. Little did he know that this seemingly ordinary day would mark the beginning of an extraordinary medical journey that would challenge everything he thought he knew about life, death, and the incredible resilience of the human spirit. The morning sun filtered through the curtains of Dwayne Teach's modest home in Fortuna as he slowly opened his eyes. Something felt different, wrong even. His body ached in ways that seemed beyond a typical cold or flu. At 58, Dwayne had experienced his share of minor illnesses, but this felt heavier, more ominous. Just the flu, he whispered to himself, pulling the covers tighter around his shoulders. The chills seemed to penetrate deeper than usual, and his chest felt tight with each breath. Still, like many people his age, Dwayne was determined to push through. He had responsibilities, routines, a life that didn't pause for feeling under the weather. His daughter, Sarah, called that evening as she did most days. "Dad, you sound terrible," she said, concern evident in her voice even through the phone. "Maybe you should see someone." "I'm fine, sweetheart," Dwayne replied, though even speaking seemed to require more effort than usual. "It's just a bug. I'll be better in a day or two." But Tuesday brought no relief. If anything, the symptoms intensified. The aches in his muscles seemed to burrow deeper into his bones, and his breathing had become labored even during simple activities like walking from the bedroom to the kitchen. Dwayne found himself sitting more often, catching his breath after minimal exertion. Meanwhile, at UCSF Medical Center in San Francisco, Dr. Kim was finishing his morning rounds. Known throughout the hospital as Dr. Miracle, for his seemingly impossible saves and lightning-fast surgical skills. Dr. Kim had built his reputation on taking cases others deemed hopeless. His team respected his judgment, his patients trusted his care, and his colleagues marveled at his ability to see solutions where others saw only problems. Another busy day ahead. Dr. Kim mentioned to Nurse Fukano, his longtime colleague and one of the hospital's most experienced cardiac care specialists, and had seen it all in her 20 years at UCSF, the victories, the losses, and everything in between. She had learned to read the subtle signs that separated routine cases from the extraordinary ones that would test every skill they possessed. "Something tells me we haven't seen anything yet," and replied with the intuition that comes from years of working in critical care. She couldn't have known how prophetic her words would prove to be. Back in Fortuna, Wednesday arrived with Dwayne feeling worse than he had in years. The simple act of getting out of bed left him breathless and dizzy. His chest pain had become more pronounced, and he couldn't shake the feeling that something serious was happening inside his body. Still, he hesitated to seek medical attention, hoping that rest and over-the-counter medications would turn things around. By Thursday morning, denial was no longer an option. Dwayne could barely walk across his living room without stopping to catch his breath. His skin had taken on a grayish pallor, and the chest pain had intensified to a level that frightened him. With trembling hands, he called Sarah. "Dad, that's it. I'm taking you to the hospital right now," Sarah declared after hearing the weakness in her father's voice. She had never heard him sound so frail, so vulnerable. The drive to Mad River Community Hospital in nearby Arcata felt like an eternity. Each bump in the road sent waves of pain through Dwayne's chest, and he found himself gripping the door handle, fighting against a growing sense of panic. Sarah kept glancing over at her father, watching his labored breathing with increasing alarm. "We're almost there, Dad. Hold on," she whispered, pressing slightly harder on the accelerator while trying to keep her own fear from showing in her voice. The emergency department at Mad River Community Hospital had seen its share of cardiac cases, but when the medical team got their first look at Dwayne's test results, they knew immediately that this case was beyond their capabilities. What they were seeing on the monitors and in the blood work pointed to something catastrophic, something that would require the expertise of a major medical center and a miracle. The fluorescent lights of the Mad River Community Hospital Emergency Department cast a harsh glow over Dwayne as he was wheeled in on a stretcher. His breathing had become increasingly shallow during the drive, and Sarah noticed that his lips had taken on a bluish tint that sent ice through her veins. Dr. Martinez, the emergency physician on duty, took one look at Dwayne and immediately called for a full cardiac workup. Years of experience had taught her to recognize the signs of serious cardiac distress, and every instinct was now screaming that this was no ordinary flu case. "Get me an EKG, chest X-ray, and full blood panel, stat," Dr. Martinez ordered as the nursing staff quickly mobilized around Dwayne's stretcher. The urgency in her voice made Sarah's heart pound even faster as she watched her father's condition deteriorate before her eyes. The EKG results came back within minutes, and Dr. Martinez felt her stomach drop as she reviewed the readings. The electrical activity of Dwayne's heart was showing dangerous irregularities, patterns that indicated his cardiac muscle was under severe stress and struggling to maintain its normal rhythm. "Mr. Teach, we need to transfer you to a larger facility immediately," Dr. Martinez explained gently but firmly. "Your heart is showing signs of significant distress, and we need to get you to specialists who can provide the level of care you need." Dwayne tried to speak, but the oxygen mask they had placed over his face made conversation difficult. His eyes, though clouded with pain and confusion, sought out Sarah's face. In that moment, she saw fear in her father's eyes, real, raw terror that matched her own growing panic. "Where are you taking him?" Sarah asked, her voice barely above a whisper. "St. Joseph Hospital in Eureka has a cardiac catheterization lab," Dr. Martinez replied. "They'll be able to get a better picture of what's happening with his heart and provide immediate intervention if necessary." The ambulance ride to Eureka was a blur of sirens, flashing lights, and urgent radio communications between the paramedics and the receiving hospital. Dwayne drifted in and out of consciousness, vaguely aware of the paramedic monitoring his vital signs and adjusting his oxygen flow. "Blood pressure's dropping," the paramedic reported to his partner. "We need to move faster." At St. Joseph Hospital, the cardiac team was already preparing for Dwayne's arrival. Dr. Reynolds, the chief of cardiology, had reviewed the transferred records and was coordinating with the cardiac catheterization lab for immediate assessment and potential intervention. When Dwayne arrived at St. Joseph, his condition had deteriorated further. His blood pressure was dangerously low, his oxygen saturation was dropping despite supplemental oxygen, and his skin had taken on a mottled appearance that indicated his circulation was compromised. "We need to get him to the cath lab immediately," Dr. Reynolds announced after a quick assessment. "This looks like a massive pulmonary embolism with secondary cardiac complications." The cardiac catheterization revealed what Dr. Reynolds had suspected. Dwayne's pulmonary arteries were blocked by massive blood clots that were preventing proper blood flow to his lungs. This was causing his right heart to work overtime, leading to dangerous strain on his entire cardiovascular system. "We need to place a stent and start him on aggressive anticoagulation therapy," Dr. Reynolds explained to the team. "But I'm concerned about his overall stability. This is beyond what we can manage long-term." As Friday morning arrived, Dwayne underwent the emergency stent placement. The procedure was successful in opening the blocked vessel, but his overall condition remained critical. His heart was still struggling, and his other organ systems were beginning to show signs of failure. Dr. Reynolds made the call that would change everything. "We need to transfer him to UCSF. This is going to require the most advanced cardiac support available, possibly including mechanical devices and eventual transplant evaluation." Sarah sat in the waiting room, exhausted and terrified, as she listened to the medical team discuss her father's condition. Terms like cardiogenic shock, multi-organ failure, and critical transport swirled around her, painting a picture she was struggling to accept. "Ma'am," Dr. Reynolds approached her gently, "your father is very sick. We've done what we can here, but he needs the level of care that only a major cardiac center can provide. UCSF has agreed to accept him, and their helicopter will be here within the hour." "Is he going to survive the flight?" Sarah asked, the question that had been haunting her for hours finally finding voice. Dr. Reynolds paused, choosing his words carefully. "Your father is fighting with everything he has. The UCSF team is the best in the world at handling cases like this. If anyone can help him, they can." As the helicopter lifted off from the St. Joseph Hospital helipad, carrying Dwayne toward UCSF, neither he nor Sarah could have imagined that they were about to enter a world where medical miracles are not just hoped for, but systematically pursued by teams of specialists who refuse to accept defeat. The helicopter touched down on the UCSF Medical Center helipad, just as the morning sun began to cast long shadows across San Francisco Bay. Inside the aircraft, Dwayne's condition had become increasingly unstable during the 45-minute flight. The flight paramedic had radioed ahead multiple times, updating the receiving team on his deteriorating vital signs. Dr. Kim was waiting on the helipad with his cardiac intensive care team, their faces grim as they listened to the final status report from the flight crew. Years of experience had taught him to read between the lines of medical jargon, and what he was hearing painted a picture of a man whose body was shutting down system by system. Multi-organ failure, cardiogenic shock, possible need for immediate mechanical support. Dr. Kim processed the information quickly as Dwayne was transferred to the hospital stretcher. One glance at the patient confirmed his worst fears. This was going to require every tool in their medical arsenal, and possibly some they hadn't used before. Nurse Fukano was at Dr. Kim's side, her experienced eyes taking in Dwayne's pale, mottled skin and labored breathing. "Room 12 is ready, and we have the ECMO team standing by," she reported efficiently. ECMO, extracorporeal membrane oxygenation, was their most advanced life support system, capable of taking over the functions of both heart and lungs when the body's own organs could no longer sustain life. As they rushed Dwayne into the cardiac ICU, Sarah arrived by car, having driven through the night from Eureka. She ran through the hospital corridors, following the directions given by security, her heart pounding with a mixture of exhaustion and terror. In room 12, Dr. Kim was conducting his initial assessment while the team prepared for emergency interventions. Dwayne's blood pressure was barely measurable, his oxygen levels were critically low despite maximum support, and his heart rhythm was becoming increasingly erratic. "His ejection fraction is less than 15%, Dr. Kim announced, referring to the measurement of how much blood the heart pumps with each beat. A normal ejection fraction is above 50%. We need to get him on ECMO immediately, and we need to prepare for the possibility of ventricular assist device placement." The team moved with choreographed precision, each member knowing their role in the delicate dance of advanced cardiac life support. Dwayne was sedated and placed on the ECMO machine, which would take over the work of his failing heart and lungs while they tried to stabilize his condition. Dr. Scott Merrick, one of UCSF's leading cardiac surgeons, arrived to consult on the case. After reviewing Dwayne's condition and the test results, his expression was grave. "This is one of the most severe cases of cardiogenic shock I've seen in recent years," he told Dr. Kim privately. His heart is essentially not functioning at all. Meanwhile, Sarah was directed to a small consultation room where the medical team could speak with her about her father's condition. Dr. Kim entered the room, his manner gentle but direct, an approach he had learned was most helpful for families facing impossible situations. "Miss Teach, your father is very critically ill," Dr. Kim began, sitting down across from her. "His heart has essentially stopped functioning effectively, which is causing all his other organs to fail as well. We have him on our most advanced life support systems, but I need to be honest with you about the severity of his condition." Sarah's hands trembled as she processed the information. "What does that mean? Is he going to die?" "We're going to do everything in our power to save him," Dr. Kim replied. "But you need to understand that his condition is as critical as we see. We may need to induce a medical coma to give his body the best chance to recover, and even then, the next few days will be touch and go." The decision was made to place Dwayne in a medically induced coma, allowing the ECMO machine to fully support his cardiovascular system while his medical team worked to address the underlying causes of his condition. The massive pulmonary embolism had triggered a cascade of complications that were now threatening every major organ system. Dr. George Wieselthaler, UCSF's leading specialist in mechanical cardiac support devices, joined the team to evaluate Dwayne for possible ventricular assist device (VAD) placement. A VAD would essentially replace the pumping function of his damaged heart, potentially buying them time for recovery or serving as a bridge to eventual heart transplantation. "His heart tissue is severely damaged," Dr. Wieselthaler explained to the team during their evening conference. "Even if we can stabilize his condition, it's unlikely his heart will recover enough function to sustain life without mechanical support." And Fukano remained at Dwayne's bedside throughout the night, monitoring the complex web of machines keeping him alive. She had seen many patients in similar conditions, and she knew that the next 72 hours would likely determine whether this would be a story of recovery or loss. As Sarah maintained her vigil in the family waiting area, she couldn't help but think about all the conversations she'd had with her father, all the moments they'd shared, and all the things left unsaid. The reality was beginning to sink in that she might lose him, and she wasn't ready for that possibility. As Dwayne entered his first night in the medical coma, connected to machines that were literally keeping him alive, his medical team knew they were fighting against time and physiology. What they didn't yet realize was that they were about to witness something that would challenge their understanding of human resilience and the power of refusing to give up. 3 days into Dwayne's medically induced coma, the UCSF cardiac ICU had become a hub of constant activity. The complex array of machines surrounding his bed hummed, beeped, and pulsed in a rhythm that had become the soundtrack of his fight for survival. Dr. Kim made rounds every few hours, studying the monitors and lab results with the intensity of a detective searching for clues. "His kidney function is deteriorating," Dr. Kim noted during the morning team meeting, his voice carrying the weight of growing concern. "We're going to need to add dialysis to his support regimen." The addition of kidney dialysis meant that yet another vital organ system was failing, requiring mechanical intervention to keep Dwayne alive. And Fukano had barely left the ICU during these critical days, coordinating the complex care that Dwayne required around the clock. She had developed a routine of checking his pupils for neurological response, adjusting his medications, and monitoring the delicate balance of the ECMO machine that was sustaining his life. "Any signs of brain activity changes?" Dr. Kim asked during one of his frequent bedside assessments. "Stable, but minimal response to stimuli," and replied. "His brain function seems intact, but with this level of sedation and his critical condition, it's hard to know what his neurological status will be when we try to wake him up." Sarah had established her own routine during these endless days and nights. She arrived at the hospital each morning, spent the day in the family waiting room or at her father's bedside when permitted, and then tried to rest in the nearby family housing that the hospital provided for situations like this. Sleep came in fragments, interrupted by phone updates from the nursing staff and her own anxiety about what the next day might bring. On the morning of the fourth day, Dr. Kim gathered the extended medical team for a crucial consultation. The participants included Dr. Merrick from cardiac surgery, Dr. Wieselthaler from the mechanical support team, Dr. Patricia Chun from nephrology for the kidney issues, and several other specialists who had become involved in Dwayne's complex care. "We need to have a serious discussion about this case," Dr. Kim began, his voice carrying a gravity that made everyone in the room pay closer attention. "Mr. Teach has been on maximum life support for 4 days now, and we're not seeing the improvement we had hoped for. His heart function remains critically impaired, his kidneys are failing, and his liver function is beginning to show signs of stress." Dr. Merrick reviewed the latest echocardiogram results. His heart muscle shows extensive damage from the prolonged lack of oxygen and the massive strain from the pulmonary embolism. Even if we can stabilize his condition, the likelihood of meaningful cardiac recovery is very low. The room fell silent as the implications of this assessment sank in. Dr. Wieselthaler spoke next. "We need to consider whether he's a candidate for long-term VAD support or potential heart transplant evaluation. But given his current multi-organ failure, he may not be stable enough for either option," and had been listening to these discussions with a heavy heart. She had seen many patients in similar situations, and she knew that the medical team was approaching the point where difficult decisions about continuing aggressive treatment would need to be made. Yet something about Dwayne's case felt different to her. An intuition developed over years of caring for critical patients. That afternoon, Dr. Kim made the difficult decision to speak with Sarah about her father's deteriorating condition. He found her in the family waiting room, staring out the window at the San Francisco Bay, her face etched with exhaustion and worry. "Sarah, I need to update you on your father's condition," Dr. Kim said gently, taking a seat beside her. "He's been fighting incredibly hard, but his condition remains critical. We've done everything we can medically, and we're not seeing the improvement we had hoped for." Sarah turned to face him, her eyes already filling with tears. "Are you telling me he's dying?" Dr. Kim paused, choosing his words carefully. "What I'm telling you is that we've reached a point where his condition is beyond what we would typically expect someone to recover from. We're going to continue providing all the support we can, but I think it's important for you to understand how serious this is." That evening, Sarah sat at her father's bedside, holding his hand while the machines continued their mechanical symphony of life support. She talked to him, telling him about her day, sharing memories from her childhood, and expressing all the things she had never taken the time to say when she thought they would have unlimited time together. "Dad, I need you to keep fighting," she whispered, squeezing his hand. "I know it's hard, and I know you're tired, but I'm not ready to let you go. We have too many things left to do together." Unknown to Sarah, deep within Dwayne's unconscious mind, something was indeed fighting. While his body was failing and his organs were shutting down, some essential part of him was refusing to surrender. It was as if his consciousness was engaged in its own private battle, determined to find a way back to the world and to his daughter who needed him. Dr. Kim made his final rounds that night with a heavy heart, knowing that tomorrow would likely bring even more difficult conversations about Dwayne's prognosis and the realistic limits of what medical science could accomplish. As the fifth day dawned, something unexpected began to happen in room 12 of the cardiac ICU. The monitors that had been showing minimal changes for days began to register subtle improvements that would surprise everyone involved in Dwayne's care and challenge their assumptions about what the human body could endure. Day 5 brought an almost imperceptible change that Fukano noticed during her early morning assessment. Dwayne's blood pressure, which had required maximum medication support to maintain even minimal levels, seemed slightly more stable. His urine output, a critical indicator of kidney function, had increased marginally overnight. "Dr. Kim, could you take a look at these numbers?" and called softly as the doctor made his morning rounds. Her voice carried a cautious optimism that she was almost afraid to acknowledge. Dr. Kim approached the bedside, studying the monitors and overnight flow sheets with the same intense focus he brought to every patient assessment. What he saw made him pause and look more carefully at the trends over the past 12 hours. "His lactate levels are improving," Dr. Kim noted, referring to a blood marker that indicates how well the body's tissues are receiving oxygen. "And his cardiac output seems to have increased slightly overnight." It was a small change, the kind that might be dismissed as normal variation in a less experienced medical team. But Dr. Kim had learned over the years that sometimes the most significant recoveries began with the subtlest improvements that others might overlook. Dr. Merrick arrived for his consultation, and Dr. Kim shared the overnight observations. "I know these are small changes," Dr. Kim said, "but in a patient this critically ill, any improvement might be significant. Let's monitor these trends closely over the next 24 hours, Dr. Merrick agreed. "If this continues, it could change our assessment of his potential for recovery." Sarah arrived that morning to find a slightly different atmosphere in the ICU. While no one was ready to declare victory or even significant improvement, there was a subtle shift in the energy around her father's care, and approached her with a gentle smile. "Your father had a slightly better night," and said carefully, "We don't want to get ahead of ourselves, but some of his numbers are showing small improvements." For Sarah, this tiny glimmer of hope felt enormous after days of increasingly grim updates. She returned to her father's bedside with renewed energy, continuing her one-sided conversations and maintaining her vigil with strengthened determination. By the afternoon of day 6, the improvements had become more pronounced. Dr. Kim called for an updated echocardiogram to assess Dwayne's heart function, and what they saw surprised everyone involved in his care. "His ejection fraction has improved from 15 to 25%, Dr. Kim announced to the team. "It's still severely reduced, but that's a significant improvement from where he started." Dr. Wieselthaler reviewed the mechanical support data and found additional encouraging signs. "His heart is starting to take on more of the workload from the ECMO machine. We might be able to begin weaning his mechanical support gradually." The process of weaning Dwayne from the ECMO machine would be delicate and dangerous. If his heart wasn't ready to take over its normal functions, removing the mechanical support could cause his condition to deteriorate rapidly. But the improving trends suggested that his cardiovascular system might be beginning to recover. Day 7 brought continued improvements, and Dr. Kim made the decision to begin reducing Dwayne's sedation levels to assess his neurological function. This was another critical milestone. Even if his heart recovered, significant brain damage from the prolonged low oxygen levels could mean that his quality of life would be severely compromised. "We're going to start lightening his sedation," Dr. Kim explained to Sarah. "This will help us understand how his brain has handled this critical period. It's possible he may start to show signs of waking up over the next day or two." And increased her neurological assessments, watching for any signs of consciousness or response to stimulation. On the morning of day 8, she thought she saw a slight movement in response to her voice, but it was so subtle that she couldn't be certain. "Mr. Teach, can you hear me?" she asked gently, watching his face for any sign of recognition or response. "Your daughter Sarah is here with you. You've been very sick, but you're starting to get better." That afternoon, Sarah was holding her father's hand when she felt something that made her heart skip a beat, a slight squeeze of his fingers against hers. It was so faint that she almost dismissed it as her imagination, but then it happened again. "Dad? Dad, can you hear me?" she whispered urgently, leaning closer to his face. "If you can hear me, squeeze my hand again." The response was weak but unmistakable, a definite pressure against her palm that brought tears streaming down her face. She immediately called for Anne, who came quickly to assess what Sarah had experienced. After several tests and gentle stimulation, and was able to confirm that Dwayne was indeed beginning to show signs of emerging from his coma. His responses were still minimal, but they were consistent and purposeful. "This is remarkable," Dr. Kim said when and reported the developments. "Given how critical his condition was just a few days ago, I wasn't sure we would see any meaningful neurological recovery." As day 8 turned into day 9, the entire medical team found themselves witnesses to something that challenged their experience and their expectations. Dwayne was not just surviving against overwhelming odds. He was beginning to recover in ways that would soon earn him a reputation as one of the most extraordinary cases in UCSF's cardiac ICU history. Day 9 began with Dr. Kim making his rounds earlier than usual, eager to assess Dwayne's continued progress. The improvements over the past 48 hours had exceeded everyone's expectations, and the entire medical team was cautiously optimistic about his potential for recovery. His oxygen requirements have decreased significantly overnight, and reported as Dr. Kim approached the bedside, and his blood pressure has been stable on much lower medication support. Dr. Kim conducted his neurological assessment, speaking directly to Dwayne while observing for responses. "Mr. Teach, this is Dr. Kim. You're in the hospital, and you've been very sick, but you're getting better. Can you open your eyes for me?" For several moments, there was no response. Then, slowly and with obvious effort, Dwayne's eyelids began to flutter. It took several attempts, but finally, his eyes opened partially, unfocused but definitely conscious. Sarah was called to the bedside immediately, and when she arrived, she found her father's eyes tracking movement around the room, though he still appeared confused and disoriented. "Dad, it's me, Sarah," she said softly, positioning herself where he could see her clearly. "You're going to be okay. You've been very sick, but you're getting better." Dwayne's eyes found her face, and for a moment, Sarah wasn't sure if he recognized her. Then, his lips moved slightly, attempting to form words around the breathing tube that was still supporting his respiration. Dr. Kim made the decision to remove the breathing tube later that morning. As Dwayne's oxygen levels and breathing patterns indicated, he was ready to breathe independently. The procedure went smoothly, and within an hour, Dwayne was speaking in whispers. "Where am I?" were his first coherent words, directed at Sarah, who had not left his side throughout the morning. "You're at UCSF, Dad. You've been very sick, but you're going to be okay," Sarah replied, tears streaming down her face as she heard her father's voice for the first time in over a week. The most challenging aspect of Dwayne's awakening was his memory. As Dr. Kim had warned Sarah, patients who experience prolonged critical illness often suffer from significant memory problems. Dwayne remembered almost nothing of his life, not his address, his job, or most of his personal history. Sarah was the only person he recognized, and even that recognition seemed tenuous at times. "The memory issues are not uncommon after what he's been through," Dr. Kim explained to Sarah during their daily consultation. "The good news is that his cognitive function seems intact. He can reason, understand new information, and form new memories. The older memories may come back gradually, or they may not. We'll need to wait and see." Dr. Wieselthaler began the process of weaning Dwayne from the ECMO machine, a delicate procedure that would test whether his heart was truly ready to resume its normal functions. The process would take several days, with gradual reductions in mechanical support while closely monitoring his cardiac function. "We'll reduce the ECMO support by small amounts every few hours," Dr. Wieselthaler explained to Dwayne, who was now alert enough to understand his medical situation. "Your heart is getting stronger, but we need to make sure it can handle the full workload before we remove the machine completely." And worked with Dwayne on basic cognitive exercises, helping to assess his mental function while also encouraging the return of lost memories. She would show him photographs that Sarah brought from home, ask him simple questions about his preferences, and engage him in conversation about current events. "Do you remember this picture?" and asked, showing him a photograph of himself and Sarah from the previous Christmas. Dwayne studied the photo intently, his expression showing the frustration of trying to retrieve memories that seemed just beyond his reach. I know that's Sarah, but I don't remember when this was taken." By day 10, Dwayne had been successfully weaned from the ECMO machine, and his heart was maintaining adequate function independently. It was a milestone that seemed impossible just a week earlier, when the medical team had privately discussed whether continuing aggressive treatment was appropriate. Dr. Kim stood at Dwayne's bedside, reviewing his progress with a mixture of professional satisfaction and personal amazement. "Mr. Teach, what you've accomplished over the past 10 days is truly extraordinary. Your recovery has exceeded our most optimistic expectations." Dwayne looked up at Dr. Kim with eyes that were clearer and more alert than anyone had dared hope. "Sarah tells me you saved my life," he said quietly. "She says I was dying, and you refused to give up on me." "You saved your own life," Dr. Kim replied. "We just provided the support you needed while you fought your way back. Your determination to survive is what made the difference." As day 10 ended, Dwayne was transferred from the cardiac ICU to a regular cardiac unit, a symbolic and practical step in his recovery journey. For the first time since arriving at UCSF, he was no longer on life support, no longer in immediate danger of death. The transfer to the cardiac unit marked the beginning of a new phase in Dwayne's recovery, one that would involve months of rehabilitation, the gradual return of his memories, and ultimately, a decision about his long-term cardiac care that would test his courage once again. Dwayne's transfer to the cardiac unit represented a victory that few had thought possible just days earlier. However, as Dr. Kim explained to both Dwayne and Sarah, surviving the immediate crisis was only the beginning of what would be a long and complex recovery journey. "Your heart function has improved significantly, but it's still only functioning at about 30% of normal, Dr. Kim explained during their first consultation in the new unit. We need to evaluate your options for long-term management, which may include a ventricular assist device or eventual heart transplantation. The concept of a mechanical heart device was overwhelming for Dwayne to process. His memory was slowly returning in fragments, pieces of his life story reassembling like a complex puzzle. Sarah had brought photo albums and spent hours each day helping him reconstruct his personal history. "This is your house in Fortuna," Sarah would say, pointing to pictures. "You've lived there for 15 years. And this is your garden. You grew the most amazing tomatoes every summer." Dr. Wieselthaler joined the team to discuss the VAD option with Dwayne. The ventricular assist device would essentially take over much of his heart's pumping function, allowing him to live a relatively normal life while his damaged heart muscle had time to potentially recover further. "The VAD is surgically implanted and connected to your heart," Dr. Wieselthaler explained, using diagrams to help Dwayne understand the procedure. "It's powered by batteries that you carry with you, and it can keep you alive and active for years if necessary." And had become more than just Dwayne's nurse. She had become his advocate and guide through the complex world of advanced cardiac care. She helped him understand his medications, taught him about his condition, and provided the emotional support that was crucial during this vulnerable time. "You're going to do great with this," and assured him. "I've worked with many VAD patients, and they live full, active lives. Some of them forget they even have the device after a while." The VAD surgery was scheduled for 2 weeks after Dwayne's initial crisis. Dr. Merrick would perform the procedure, which involved opening Dwayne's chest and connecting the mechanical device directly to his heart. It was major surgery, but given Dwayne's remarkable recovery from his coma, the team was optimistic about his ability to handle the procedure. Sarah struggled with the decision, terrified of putting her father through another major medical procedure after everything he had already endured. But Dr. Kim helped her understand that without the VAD, Dwayne's damaged heart would likely fail again within months. "This device gives him the best chance at a meaningful life," Dr. Kim explained. "It's either this, or we wait for a donor heart to become available, which could take years and might come too late." The night before his VAD surgery, Dwayne had a long conversation with Sarah about their life together and the future he hoped to have. His memory had returned enough for him to remember the important moments: Sarah's childhood, his late wife's battle with cancer, the quiet life he had built in Fortuna. "I'm not ready to leave you yet," he told Sarah. "If this device can give us more time together, then I want to try it." The VAD surgery went smoothly, lasting about 4 hours. Dr. Merrick emerged from the operating room with encouraging news for Sarah, who had spent the entire time in the surgical waiting area with and keeping her company. "The surgery went very well," Dr. Merrick reported. "The device is functioning perfectly, and his heart responded well to the reduced workload immediately." Recovery from VAD surgery was different from his previous experience. Dwayne was awake and alert throughout the process, learning to live with the mechanical device that was now literally keeping him alive. The batteries needed to be charged regularly, the driveline required careful maintenance, and there were new medications to prevent infection and blood clots. As Dwayne adapted to life with his VAD, spending 7 months learning to live with this mechanical heart, he and his medical team began to discuss an even more extraordinary possibility: the chance for a completely new heart and a second chance at a normal life. Today, more than a decade after that frightening Monday morning when flu-like symptoms nearly ended his life, Dwayne Teach sits in his living room in Fortuna, California, with a strong, healthy heart beating in his chest. A heart that once belonged to another person who made the ultimate gift of life possible. The heart transplant surgery took place on May 26, 2012, after 7 months of living with the VAD device. When a compatible donor heart became available, Dr. Merrick and his team performed the transplant surgery that gave Dwayne not just survival, but a return to truly normal life. "I have no signs of rejection, and I feel better than I have in years," Dwayne reflects on his journey. His memory returned almost completely, and he was able to return to many of the activities he enjoyed before his illness. Most importantly, he was able to continue building memories with Sarah and eventually meet his grandchildren who were born after his recovery. Dr. Kim still practices at UCSF, continuing to take on cases that others might consider hopeless. When asked about Dwayne's case, he speaks with the quiet pride of a physician who witnessed the impossible become possible through the combination of advanced medical technology and human determination. Dwayne taught us that we should never underestimate the power of the human spirit to fight for life, Dr. Kim says. Yes, we had the technology and expertise to support him through his crisis, but ultimately, it was his refusal to give up that made all the difference. And Fukano often refers to Dwayne as one of her star heart transplant patients, praising his commitment to following his medication regimen and maintaining his follow-up care. Their bond, forged during those critical 10 days in the ICU, remains strong more than a decade later. The lessons from Dwayne's story extend far beyond the medical details of his case. His journey demonstrates that miracles in modern medicine aren't just about advanced technology or surgical skill. They're about the human connections formed between patients, families, and medical teams who refuse to accept defeat. For anyone facing a serious medical diagnosis, Dwayne's story offers hope that even the most dire circumstances can sometimes have unexpected outcomes. It reminds us that fighting for life, whether as a patient, family member, or healthcare provider, is always worthwhile, even when the odds seem impossible. As Dwayne puts it simply, I feel incredibly lucky to be alive to share my story with you today. His gratitude extends not just to the medical team who saved his life, but to the unknown donor whose heart continues to beat strong in his chest, and to his daughter Sarah, whose unwavering presence during his darkest days helped guide him back to the light. The gift of life, whether sustained by mechanical devices, transplanted organs, or the healing power of human connection, continues to beat strong in Dwayne Teach, a living testament to the extraordinary things that become possible when medical expertise meets unbreakable human spirit. Take a moment today to appreciate the gift of your own heartbeat, and remember that sometimes the most powerful medicine is simply refusing to give up hope, even when all seems lost.